A Los Angeles hospital paid a $17,000 ransom to hackers who had infiltrated and disabled their computer network. Hollywood Presbyterian Medical Center paid 40 bitcoins, currently worth about close to $17,000 U.S., after the cyber attack that began February 5th. The hospital CEO says it was in their best interest to pay the ransom. Patient care, they say, was not affected. Patient data was not compromised. The FBI is now investigating as well. For more insight on this, Claudiu Popa joins us now from North Bay, Ontario, cybersecurity expert specializing in advising healthcare groups. Thanks for joining us today. Claudiu, have you heard of this kind of thing before, where companies or institutions are paying ransoms to avoid being attacked?
Yes, cyber extortion is one of the top threats this year. Unfortunately, it's growing. And unfortunately, it's also targeting Canadian organizations, so it's a particular concern.
Is it best for an institution to actually pay the ransom, or does it depend on the circumstance? It seems to set a bad precedent to pay.
Unfortunately not. So the thing about it setting a precedent, people have been paying these ransoms for years, if not decades. We just don't hear about it. And the reason they pay these ransoms is intricately linked to the fact that it's not going to come out. So there is no precedent to set. And in fact, there is an actual model whereby if they didn't pay it, then this whole business model would collapse. And this is really why cyber extortion has been thriving. And there are new versions of ransomware coming out every month, in fact. They're very difficult to detect, unfortunately. And when it comes to organizations that have a critical impact on people's safety and security and health, this is a particular concern. As far as them paying the ransom, they didn't pay the $3.6 million. They paid a very, very, very small part of that. And what we suspect is what's happening now is the FBI is trying to trace those funds. So it was probably a specific decision that led to them paying that small amount. All that to say that that really, without paying, they would not have had access to their information.
This is pretty scary for most of us who hand out our information in one way, shape, or another every day, especially medical information, who you trust with your doctor and hoping you're being protected.
Right.
Is there a system, a security system that people need to have in place that could stop this, or is this just going to happen and we should expect it at some point?
A bit of both. Unfortunately, it's growing, and so we have to expect it to happen. That means it has to be a part of the preparedness planning and programs, security programs of organizations, so financial organizations, healthcare, education, etc. However, there are three key steps that organizations like this really need to keep in mind. And of course, the first one is to secure the endpoints. That means secure the computers, secure the actual laptops and desktops that are being used to collect personal information and also that have internet access. If those are secured, then that kind of cyber extortion cannot propagate across the network. So most organizations are able to secure the gateway, which is to say the servers and the routers, but little is done to secure the endpoints. And the other two things that need to be done are, one, hospitals, healthcare organizations, medical facilities need to inventory the personal information that they are the custodians of, so that they know what is the potential for losing that and compromising it, and also that they know where it is, which hard drives it is on specifically, who's got access to a copy, etc. This Hollywood hospital's particular situation showed in many ways what not to do, and that wasn't necessarily their fault because they had not planned for it. But the third recommendation, and really the third things that any organization needs to do, is to have an actual business continuity plan, so that when this kind of thing, or if this kind of thing cripples your operations, you don't take the wrong steps. So for example, in this particular case, we only heard about this a week after it occurred. They sat on the information and they downplayed it, and then they finally came out with a statement saying that personal information was not impacted. and now a week later, or a couple of days later, they're saying, well, we needed to pay this so that we can gain access to the personal information, et cetera. In other words, if you have a plan, you also have a communications plan that makes the victims feel a little bit safer, and it gives you that level of trust that somebody in the organization knows what they're doing, and you have a step-by-step plan to address it.
All right, preparation always key here. We got to leave it there. We have cyber expert Claudiu Popa joining us today from North Bay, Ontario. Thank you for your time.
You're welcome.